Lately, a very controversial topic has been regarding the relationship that blood pressure holds with cardiovascular disease. Hi, my name is Julie Martinez,
My name is Florence Renteria.
And my name is Emely Lopez.
and we're here to present our research with the hopes of bringing awareness about an abnormal blood pressure.
In this research, the team studied hypertension and its expanding danger of the scope of infections such as coronary illness, strokes, cardiovascular breakdown, aortic aneurysm, chronic kidney disease, and renal disease. This research aims to expand the knowledge on blood pressure and determine whether abnormal blood pressure correlates to heart disease. The team gathered 6 articles pertaining to the topic, which is important to inform the community and bring awareness amongst each other. Normal systolic blood pressure is less than 120 millimeters of mercury, and normal systolic blood pressure is less than 80 millimeters of mercury. Any systolic blood pressure reading lower than 90 millimeters of mercury and any systolic blood pressure reading lower than 60 millimeters of mercury would be considered hypotension. Through the article analysis, it was learned how blood pressure may be manipulated and controlled not just through medication, but through food and exercise. However, a study showed that the prevalence of high blood pressure declined from 2005 to 2008 to 2013 to 2016 per both guidelines.
Materials and methods. During fall 2020 and spring 2021, research was gathered on blood pressure to determine whether the hypothesis stood correctly. Different types, causes, and consequences of abnormal blood pressure and different stage of development, such as children or pregnant women, was researched during the fall semester. Each team member gathered data from 10 patients of their choice. A total of 30 different participants participated. Data gathered include body mass index, blood pressure, pulse pressure, height, weight, and heart rate. The ultimate goal for this research was to obtain adequate blood pressure data from our community. The materials that was utilized to conduct data include cyclometer, blood pressure cuff, disinfecting supplies, stethoscope, and a weight scale. In Figure 1 show us other material utilized by each team member. Figure 2 show us how we took blood pressure, and in figure number 3 we can see how we sanitize our materials. Data. Female blood pressure and pulse pressure. Figure 1.0. Female patients illustrated above with their pulse pressure, millimeters of mercury, and blood pressure as a systolic and diastolic in one graph in ascending order from youngest to oldest. Figure 1.1 Male blood pressure and pulse pressure. Male participants, as shown above, illustrate their pulse pressure, millimeters of mercury, from the youngest to oldest, also demonstrating systolic and diastolic as their blood pressure. Figure 1.2 Female body mass index. Female participants illustrate above with their body mass index in one graph in ascending order from youngest to oldest. Figure 1.3 Male body mass index. Male participants illustrated above with their body mass index in one graph in ascending order from youngest to oldest.
For the results, the research had 17 female participants and 13 male participants. All 30 participants were above the age of 18. Both male and female heart rates were within the normal ranges, the normal ranges being 60 to 100 beats per minute. Female blood pressures were within the normal ranges, their systolic pressure being within 90 to 120 millimeters of mercury, and their diastolic pressure being within 60 to 80 millimeters of mercury. On the other hand, 50% of the male participants had high blood pressure. Their systolic pressure was within 130 and 139 millimeters of mercury, and their diastolic pressure was within 80 to 90 millimeters of mercury. The other 50% of the male participants were within normal blood pressure ranges. Conclusion. In conclusion, blood pressure measurement is a common and important procedure. As people age and increase in blood pressure is inevitable. It may lead to hypertension, but as mentioned in our research, it may be controlled. More research is always needed. Research helps in not just expanding our knowledge, but also practicing skills. A limitation was the great availability to document others' blood pressure due to COVID restrictions and social distancing. The team would like to return to the same patients in the next few months and gather data to compare to the previous data, as well as note if they made any specific changes to improve their well-being. Acknowledgements. Dr. Nora Garza, Vice President for Research Development and External Affairs Department for Research Development, Laredo College. Rosemary Agüero, LEAPS Project Director, Department of Research Development, Laredo College. Dr. De La Torre, Department of Natural Science, Laredo College. Sabrina Rios, Student Mentor. Kathleen Chavez, Student Mentor. Gabriela Solis Cavazos, Undergraduate Research Coordinator, Department of Research Development, funded by Hispanic Servant Institute, Title III STEM, Articulation and Project Title III LEAPS. And if there's any questions, feel free to ask. Thank you for listening to our presentation.